right. Hi, everyone. Thank you so much for joining our webinar today. I see a lot of folks coming in, so I'll give people another minute to trickle on in before we get started. All right, so hi everyone. Welcome to the Social Workers Confronting Racial Injustice Conference. Thank you so much for joining us for this breakout presentation entitled Abortion Funds as Collective Care, Organizing for Reproductive Justice in a Post-Dobbs America. So my name is Celina. I'm an assistant professor here at the University of Wisconsin-Madison Sandra Rosenbaum School of Social Work. And as a brief visual description, I'm currently seated. I have long brown hair, and I'm wearing a black long sleeve shirt. So before we get started today, I'd like to acknowledge the land we are on. So on behalf of the Planning Committee for the Social Workers Confronting Racial Injustice Conference, I ask that you join me in acknowledging that our University of Wisconsin-Madison campus resides within the sacred homeland of the Ho-Chunk people, a place they call Dejop, or Four Lakes. We respectfully recognize the inherent sovereignty of the Ho-Chunk and the other 11 First Nations here in Wisconsin. So whether you're watching this here in Wisconsin on the land of these 12 First Nations, or you are in a more distant place, we encourage you to learn about the history of the land that you're on. As social workers, we have a duty to look critically at the role of our profession and what it has played in the genocide and destruction of Indigenous families. This conference aims to bring clarity about the past, but also seeks to challenge and inspire us all into action to support Indigenous rights, racial equity, and reproductive justice. All right, so before I introduce our amazing panelists today, I have a couple of Zoom housekeeping notes. So this presentation is being recorded and will be available on our conference website at a later date. And to access this presentation, you were required to provide your name and email address. And that allows us to keep track of our attendees, but particularly if you're looking for CEUs for this session, we'll be able to distribute those via email at a later date. For all the attendees, your cameras and microphones will be muted the entire time. You won't have access to the chat, but you will be able to ask questions through the Q&A feature. So we encourage you all to submit questions for our presenters that way. And please know that due to the large volume of attendees, we will not be able to get to all of the questions that are submitted today. Our conversation will be about 70 minutes, and we won't be taking a break, but as attendees, please know that you're free to take a break as needed. All right, so I'll ask our presenters now to turn their cameras on so I can introduce our 5 incredible leaders of abortion funds from across the country. So it's really my pleasure to introduce you all to our presenters. So we have Alison Dreith, Irma Garcia, Kelsea McLain, Porsha Pinder, and Ali Muldrow. So Alison is the Director of Strategic Partnerships at Midwest Access Coalition, which is a practical support abortion fund. With over 15 years of experience in abortion movement work, she has served as Quality Assurance for Women's Health Specialists, Deputy Director at Hope Clinic, Executive Director of NARAL Pro-Choice Missouri, and has worked at Planned Parenthood of Great Rivers. Irma Garcia is the Director of the Reproductive Health and Education Services at Jane's Due Process, based in Texas, where she has dedicated 6 years to advancing the organization's mission. In her role, she facilitates access to abortion care, curates and delivers the organization's sex ed program, and leads a team committed to providing comprehensive pregnancy support. Her work is rooted in the belief that everyone deserves not only access to reproductive health services, but also the opportunity to experience pleasure and well-being. Kelsey McLain is the Healthcare Access Director for the Yellowhammer Fund, a reproductive justice direct service advocacy organization based in Alabama. She supports their work rooted in abortion advocacy and greater healthcare liberation across the Deep South. She has worked in the realm of abortion rights and advocacy for over a decade, including doula work directly with abortion seekers, abortion clinic defense with the Triangle Abortion Access Coalition, and doing direct case management for abortion seekers navigating funding barriers and board work with abortion funds. Porsha serves as the co-executive director of the Baltimore Abortion Fund. As a queer woman of color with a background in intimate partner violence, Porsha is deeply passionate about dismantling systemic barriers to reproductive access. She believes all pregnant individuals deserve full autonomy over their bodies and choices, and is committed to creating holistic client experiences by offering compassionate and practical resources and support. And finally, Ali is the executive director of the Wisconsin Abortion Fund here in Wisconsin, and she's also a native to Madison, Wisconsin. She is an educator, an activist, an organizer, a mother, a doula, who has worked with unwavering commitment to abortion access as it is connected to racial, economic, and reproductive justice. So thank you all so much to our amazing panelists for joining us today for this conversation. So I'll now open our conversation by posing some questions to you all. So we'll just go around the Zoom room, but first, can you please introduce yourself and share a bit about your abortion fund?
Hey y'all, I'm Ali Muldrow, and I am the executive director of the Wisconsin Abortion Fund. I want to thank you so much for that really loving introduction of all of us. It's such an honor to get to be part of this group of people. The Wisconsin Abortion Fund funds abortion in 3 states, Wisconsin, Minnesota, and Illinois. We also fund abortion in multiple contexts and multiple methods and approaches to abortion. We work with dozens of abortion clinics across all 3 states. We also work with hospitals and Just the Pill, which helps people to self-manage their abortions. I'm really looking forward to the conversation, and I wanna pass it to who's ever ready to go next.
Yeah, how about Kelsey?
Hey y'all, excuse me, I'm Kelsey. I use she, her pronouns, and I am actually based in North Carolina, but I do support Alabama through my work at Yellowhammer Fund. Yellowhammer Fund is an abortion fund that currently isn't funding abortion. We are currently navigating a lawsuit against the Attorney General of Alabama that basically will affirm our right to fund abortion care, help people leave the state, make referrals, do what people deserve, which is have support, companionship, and appreciation along the way. But our greater work is focused in reproductive justice. We have a thriving family justice program. I am fresh home from a 2-week stint in Alabama, kicking off our 4-year Power Bus Tour, which is hitting rural communities with diapers, safer sex supplies, and more. So excited to be here with you all.
Thanks so much, Kelsey. How about Porsha?
Thank you. Yeah, my name is Porsha Pinder, use she and they pronouns. Like Celina said, I'm the co-executive director at BAF. And BAF has existed for 10 years. Actually, last year, it started as a volunteer-run organization that was kind of an offset of the DC Abortion Fund, and it started out funding only in Baltimore City. And over the last 10 years, we've been able to staff up, specifically in the last 3 years. And in the last 2 years specifically have done over $1 million or just under $1 million in practical support and abortion funding support to abortion seekers living in and traveling to Maryland. We offer like a full spectrum of services. So we do funding, but we also help with practical support. So helping folks get to their appointments, travel in, hotel while they're here, a warm meal so they don't have to go without, and the goal for us is really to make sure that we can make it as easy as possible for someone to access healthcare, which is what abortion is. And specifically for Maryland, our legal landscape, we are considered a protected state. There's a controversy within our fund about the idea of a safe haven, but we are a protected state. So in Maryland last year, we voted to enshrine the right to abortion and reproductive rights in general into our state constitution. We do have a shield law that protects providers and pregnant individuals from any kind of litigation that would reach into the state to criminalize them. And we also, within the last couple of years, made it mandatory for Medicaid and some private insurances to provide abortion coverage for individuals who have those plans. So that's me, and I'll pass it to, well, that's BAF, that's not me, but I am one and the same, and I'll pass it to whoever wants to go next.
Great. What about Irma?
Hi, everyone. My name is Irma. I use she, her pronouns. I'm the director at Jane's Due Process for our Direct Services Department. And at Jane's Due Process, we are dedicated to bridging the gap between young people in Texas to access confidential and compassionate reproductive health care services such as abortion care, contraception, STI testing, and we also provide sex education virtually. And we still help young people navigate parental consent laws, whether they are in Texas or in a different state. We are the only abortion fund in the country that serves minors. We are still able to help them confidentially access legal and safe abortions in other states. And yeah, that's a little bit about us. Legal context about the state, we like to say it's ground zero when it comes to abortion bans, but to be frank, the country has made it difficult for everyone to access abortion care. But right now, Texas has a total abortion ban with no exceptions for rape or incest. It criminalizes providers. It also terrifies people into thinking they'll be arrested for seeking care. But people are still managing and self-managing their abortion safely and still able to cross state lines and still finding abortion funds to get support from. So yeah, that's a little bit about us.
All right, and that leaves Alison.
Hi, everybody. My name's Alison Dreith. I'm the Director of Strategic Partnerships at Midwest Access Coalition, which is an abortion fund, but unlike traditional abortion funds, we solely provide practical support to help people access safe abortion care. So things we pay for and coordinate are travel, accommodations, childcare, food, any kind of incidentals clients might need to even get to their appointment, because this crisis didn't start with the Dobbs decision. I spent 11 years of my abortion movement work in Missouri, where there was only one abortion clinic for the entire state. And so people have always been traveling for this care. We support people who live in the Midwest, no matter where they need to go, because currently there's no clinic that provides third trimester care in the Midwest, but that will change in April. We'll be getting the first clinic in Chicago, or anyone traveling to the Midwest for care. Since the Dobbs decision, it's practically looked like we're an abortion fund living or working in the South, because our numbers have just skyrocketed from places like Texas and all across the country, really. So very happy to be here today. The Midwest's legal access looks very different. We consider the Midwest 12 different states, from Ohio all the way to the Dakotas, and then from Minnesota down to the Boot Hill of Missouri. So there's about 6 states that still have legal access to abortion care and 6 states that have banned, but that's ever changing. I currently live in Illinois, where we're also, like Maryland, a state that has protected or tried to enshrine the right to abortion in our Constitution and pass shield laws to make sure people working at abortion funds, abortion providers, or the clients we all support are protected to the best of Illinois' ability in this new administration.
Thank you all so much for sharing that introduction to yourselves and the funds that you're coming to us from. So you all started to speak to this briefly in your other answers, but we know that abortion funds do a lot more to support people than just accessing abortion. So Kelsey started talking about this bus project, right? That's distributing diapers and other things. So can you tell us about what other kinds of work you do and why that's equally important for advancing reproductive justice? So I'll throw that question to you first, Kelsey.
Yeah, so Yellowhammer Fund definitely started out as strictly a abortion funding organization, but as the attention to our organization grew because of state attempts at abortion bans and media attention, we had an opportunity to expand our programming in ways that we knew our communities needed beyond abortion care, which was family justice. And our first priority with family justice was just making sure we had a way to do kind of direct one-on-one case management. That brought about our first family justice organizer, who is Janice Fountain, who is now serving as our executive director back in 2022, if I remember correctly, or actually before that. I think Janice has been with the fund since 2019. So let me correct myself. But it just became clear that when we were in community, when we were doing outreach, people had needs beyond abortion funding and support. They needed diapers, they needed rent money. Alabama is a state that has several laws on the books that directly criminalize pregnancy outcomes, and especially in relation to substance use. We have had people in Alabama have their children removed and charged with felonies for child endangerment for drugs they were given by the hospital. So it's very clear that there are substantial huge issues related to people's reproductive justice and freedom in the state. And we just felt we were doing a disservice only addressing one very small piece of it. That certainly was not a need that everyone in the state had. From this, we rapidly kind of ramped up this family justice programming and support after Dobbs, especially when we found that one of our biggest budget lines, which was our abortion fund, was no longer money that we could spend out. So it became a priority to us to make sure that we were resourcing other reproductive justice community-facing organizations that were going to be picking up our slack and able to navigate with abortion seekers in ways more directly than we can publicly safely do. And also we knew we needed to have a way to get into community and get to people who can't like find us in Birmingham, which led to the purchase of the Repro Raven, which is a great little repurposed shaved ice bus that we now fill with diapers, wipes, formula, most recently teddy bears and Legos, lunches, and a few other things. And we take it out into community. Currently, we're, like I mentioned, we're operating a bus tour that is focused on our rural communities. We are in week 3. We're about to start week 3. It's an 8-week-long tour. We've already hit 12 different communities, and we've easily distributed I should have more math than this, but we've distributed just hella resources. And that is, for us, this framing larger than abortion access was really important to ensure that the organization is always here. If we were just doing abortion, if we were not creative enough to think beyond abortion and understand that people have needs beyond that, Yellowhammer Fund would not be here providing these services, fighting the Attorney General to ensure that people can safely transport folks across state lines, and potentially poised to reopen and resume our funding support. And essentially, our communities need us. It's not like the diaper need goes down when you have an abortion ban. So for us, it's just not only a matter of organizational survival, but community survival, addressing the needs when we can fund abortion. We don't want folks coming home to lights being off. We don't want folks coming home to being 2 to 3 weeks behind on bills and having no plan to catch up. So it's all a part of building an ecosystem that will ensure interacting with Yellowhammer Fund means that you're feeling a little bit more secure, a little bit more stable, and a little bit more safe in a state that is very hostile to your existence.
That was so powerfully put. Thank you, Kelsey. What about you, Ali?
I'm sorry, I got so caught up in your response that I lost the question a little bit. Do you mind repeating?
Yeah, of course. Yeah, I know it was very powerful. So we know that abortion funds do more than just support people in accessing abortion. And so can you tell us about some of the other kinds of work that your fund does, and why that's equally important for advancing reproductive justice?
Yeah, so I think part of the work that we do is we tell the story of what it means to have an abortion from 1,000 perspectives every year. We help thousands of people get abortions, and we champion their voices and their stories to the ability that we can and that folks give us permission to, and really kind of expose people to the realities of pregnancy and medical complications related to pregnancy. I think there's so much misinformation and misrepresentation of pregnancy. And I think one of our greatest roles is to educate people and allow people to have a precise understanding of the nuance of why people have abortions. I think, since Wisconsin experienced its own total abortion ban and criminalization of abortion for over 400 days, we really moved into the area of practical support and partnership. And that means helping people cover the cost of daycare, helping people cover the cost of transportation and lodging as it relates to abortion care. I think, destigmatizing abortion and the procedures that are abortion or the medications that allow for abortion is another area in which, we are pretty much constantly working to make sure people understand the histories of these medications and the safety implications of these medications, and are really talking about abortion from a place of accuracy that is well informed. And so I see that as, these huge portions of our work that are deeply important to us as an organization. And I so appreciated your answer, Kelsey. Thank you.
Awesome. What about you, Porsha?
I can't follow either of them up because the work that Yellowhammer is doing is incredible. And I think my answer is very similar to Ali's. I think destigmatization is a big piece of the work that we do. And having an abortion is healthcare in the same way that having your wisdom teeth extracted is healthcare. And I think the way that it's allowed to be othered or political is all in how people think of it. And so the work that we do is really to talk about it as what it is. And especially one thing that we've spent a lot of time on is there's no right or wrong abortion. That's something that we see a lot in Maryland, where people are more progressive in the way that they support abortion, but it has its limits, like a certain gestational age or a certain number of times someone can have an abortion, or they have to be going through certain circumstances to qualify. And the reality is that the only need for an abortion that someone should have, or what makes it okay, is the fact that they want one. And so we spend a lot of time trying to destigmatize and eliminate the shame that's associated with it, because we know that shame is a really powerful tool in preventing people from trying to access care. And so we just work as much as we can to normalize it, because it is a normal thing, and it shouldn't be this big topic. It shouldn't divide families, and it should just be no one's business. And there's no real reason for anyone to get an abortion or I don't even know what I'm saying. I'm trying to talk about something in a way that is eloquent. And the reality is that abortion is normal, and that's how it should be treated. And people need to mind their business, and they need to support people and what they want to do. And the only thing I would say in addition to that is just how we are providing support to abortion seekers has changed a lot over the years. We really want people to be able to access the care that they want the way that they want it. And so it's not just like getting a volunteer to take someone to their appointment, but it's paying for someone to get new tires or a car inspection so that they can drive themselves to their appointment. It's about making sure that people can access the care that they want the way that they want to without limitations or barriers. But I'm going to stop myself here because that was quite the ramble, and I'll pass it to whoever wants to go next.
No, that was incredible. I think you did a great job articulating both the importance of like destigmatizing abortion, but also the way in which abortion funds fill so many other needs to allow people to access the care in the ways they want to. That was really well put. And I think, Alison, you talked about this as well in terms of like the practical support and whatnot. So could you talk a little bit more about that as well?
Yeah, as I mentioned kind of in my introduction, I was born and raised in Illinois and had the opportunity to come back here during the pandemic. Um, but I spent 11 years of my abortion related work in Missouri, which at the time only had one abortion clinic for the 11 years that I lived there. They actually stopped providing abortion care outside of one hospital in Missouri back in 2019. And Planned Parenthood just quietly moved their clinic across the river to Illinois. For all intents and purposes, they were, shut down way before the Dobbs decision. And that's one of the reasons Midwest Access Coalition was founded to provide practical support care because we knew, um, most people living in the United States that needed abortion care lived over 200 miles from an abortion clinic pre-Dobbs. And their lives in on top of the state hurdles um, that legislatures were already putting up with waiting periods like 24, 48, 72-hour waiting periods, trap laws that were egregious to um, make clinics shut down, is that abortion seekers themselves couldn't get off of work, couldn't miss that time away from work because they needed the money on their paycheck to feed the children that they already had or to pay the electric bill. They couldn't not only afford their abortion procedure already because there were bans on state funded or even sometimes, like in the state of Missouri, private insurance um, bans on abortion care, and people weren't making their appointments. When you make an abortion appointment, we're expected at the clinic that about 50% of those original appointments don't make it to that first appointment. And it's not because abortion seekers are changing their minds. Abortion is really popular. 1 in 4 women, just women, not all the other people that access abortion care, will have an abortion in their lifetime before they're 45. And so we needed to do something to make sure people were getting the healthcare that they needed, wanted, and deserved. And so that's why, thankfully, practical support has become so important, I think, for all of us, whether it's our sole focus like MAC or our amazing other abortion funds around the country that are doing this work to pick up some part of those pieces. How can people even get access to care if they can't find a babysitter or their child's not able to eat dinner that night? And so filling those gaps with childcare, with food, with incidentals, travel, a hotel now that travel is over 400 miles, for a person to access that care in this country. Um, it's it's more important than ever to help support in as many of those gaps as possible.
Absolutely. And I know Irma, Jane's Due Process does a lot of this work outside of just supporting abortion. So can you share a little bit about that?
Yeah. Oh my gosh, yeah, like everyone said, I feel like we're all going to be repeating how amazing everyone's work is. But one of the big tenets at JDP is that we're not just paying for procedures, we're also shifting culture. We're trying to build power among young people. And that's part of the reason why we talk about pleasure in our sex education. We're making sure that young parents have what they need to thrive with our programs that are a part of like the practical support and the abortion support funding, and the hotline and text line that we have that's 24 hours. We also have a free repro kit program where people can just text us and we will drop the repro kit wherever they want it, like in a more secure space. It doesn't have to be at their house. And that repro kit has free pregnancy tests, free Plan B, condoms, lube, um, zines that talk about STIs, pleasure, abortion, resources. And we are working on adding more resources about housing, food instability, and more know your rights zines based on what's going on currently with the current administration for immigrant rights and stuff like that. We also have programs where the young people that have been through the judicial bypass process in the past or have gone through the abortion process period in Texas can be a part of our fellowship program where we pay them once a month to be a part of that program where they learn life skills, how to be able to advocate for reproductive health, and many more different tenants in that that our coworkers manage. We also have a youth content squad where they manage doing our social media with TikTok videos and stuff like that. And that is one way of busting stigma by having young people front and center of it. The Empowering Young Parents Parenting Support Program is fairly new. It's a pilot program that just got released last fall. And we are recruiting young parents in Texas that either were not able to get an abortion or were forced to get, or were forced to, or were forced into parenthood, be a part of that program so that we can assist in helping them thrive as best as possible the first several years of when it comes to pregnancy and all the way up to 2 years of childhood. And they also get a stipend. We assist with life skills as well, like building resumes, finding daycare, finding midwives, finding doulas, and finding that community amongst other young parents for our clients. Then we also have Sex Talks, which is a virtual sex education program where a virtual course is held quarterly, and we center pleasure and queer rights at the center of it all when it comes to pregnancy, abortion, STIs, like everything that sex education is. And we just flip it over and make it more pleasurable and joyful and fun. And then, of course, we're a part of judicial bypass tables and research opportunities with different universities and organizations that center youth and where they're at and what they're going through in the country. So yeah, probably can't follow what everyone's been talking about, but yeah, it's amazing.
That was incredible. You just listed like this long list of amazing ways that Jane's Due Process is meeting the needs of the community. So I think it's really powerful to hear from each and every one of you to learn a little bit more about how abortion funds do so much more than just abortion, right? Like they're truly meeting the needs of the community, working anywhere from destigmatizing abortion to providing practical support or things like diapers or sex education. It's really powerful. This has also come up a bit in our conversation so far, but we know that we're currently living in really an uncertain and unsafe political moment where attacks on bodily autonomy are rampant. But we also know that these challenges existed long before the current Trump administration, long before the Dobbs decision, particularly for marginalized communities. So I'm curious what lessons you all have learned from navigating these changing political climates over time. So I'll send that maybe to Kelsey first.
I think the biggest, and I think this is not so much a lesson I've learned, but a lesson I'm seeing other folks learn is like, these are not Southern or Midwestern or red state problems. They can quickly become problems we all have to navigate. And it's important to not get caught unprepared. Like, you have to have a plan for navigating a worst case scenario. And then also, real specifically, something I have been learning lately, and I'm still in a processing phase because this is all very recent. But we've been in community, like real deep in community, and some of the most conservative, rural, potentially like dangerous for people who aren't white parts of the state. And people are deeply religious. People are deeply conservative. They have views that you shouldn't have sex until marriage. They're still taking safer sex kits from us because they recognize that these views don't mean that people always act on those views. They're telling us we're doing God's work when we're in their community with a bus that says "fuck your abortion" ban on it. So I think fundamentally, like, we know this to be true, but we're seeing it play out. Like, people fundamentally don't understand that our politics do inform our access to resources, our access to housing, our access to food. And fundamentally, people desire all of these things. And that's where I'm in a processing phase right now, is like, how do we really start bridging gaps and help folks understand, like, no, an abortion fund is actually not in opposition to you and your family and your values. Yeah, but I haven't thought on it yet, so I'm gonna stop rambling.
That's awesome. I know, Alison, you also talked a little bit about this when you were telling us about how you'd lived in Missouri for so many years. So what lessons have you learned from navigating these changing climates?
That how important organizing is. When I moved to Missouri in 2008 from, um, you know, college or whatever, and finally settled down. I'm from rural Southern Illinois, which is, trying to succeed from Chicago right now. So just because I'm in a blue state doesn't mean I'm in any more safe area than some people. But I moved to the big city in 2008, and back then, Missouri had a Democratic governor, one Democratic U.S. senator, and a pretty mixed bag, even down political lines in the legislature. And so, as somebody too, also from Southern conservative Illinois, and I have seen the Democratic Party leave a stronghold in their state because, labor unions, or the mining jobs, or those good union jobs are gone now. Like, once you stop organizing, you start losing everything. And I think a lot of that has happened, and it happens throughout movements and throughout history as things ebb and flow. But it just shows, I think, how important deep organizing is. If you like what Kelsey's doing in Alabama, when you show up in those communities, even if you're on different political parties or whatever, people support you more, they understand more. That's why we're seeing in places like Missouri and places like Ohio, that have had successful abortion ballot initiatives over the past few years, and are trying to regain those rights in places like Missouri, and have, stopped the freaking legislature in Ohio, which was a miracle that I could have never in a million years guessed. So just, it's no time to hide. The cowards that are in office now will go back to the holes that they came from one day, but only if we continue to speak out, show up, be in our communities, and really organize them to understand these issues. Because we know 7 in 10 people support abortion care in this country. It's just politicians that aren't popular. So, organizing is something that I think is so important, and not forgetting those communities that aren't, in big cities or, are more rural than others. They're just as important and can um, s- show which way the wind blows a little bit more than I think urban areas can.
Thanks so much, Allison. I appreciate that perspective. Ali, I'm curious how you've navigated Wisconsin's changing political climate over time.
Oh, I think this is such a great question. And I think one of the real lessons learned in navigating Wisconsin is kind of to get to know the opposition, right? And I think one of the things that really shocked me about the folks who are anti-abortion access is how different their stance actually is from their messaging to the greater public. Because you think when a movement really kind of postures itself around valuing people's lives, that there would be some ability to reconcile that abortion is life-saving medicine for a lot of people. I've also really learned, like, I have 3 babies, y'all. I've had 2 home births and a hospital birth. I've had a tremendously medically complex pregnancy. I've had multiple abortions. I came into this work feeling like I understood this. I've worked statewide for the majority of my career. It's been a real shock to talk with people who have such passionate views about abortion and don't know anything about pregnancy, don't know what a molar pregnancy is, don't know what an ectopic pregnancy is, do not know anything about pregnancy and feel entitled to impose their views on someone else's medical reality. Um, and so I think a lot about, what it means to live in a world where the number one cause of death during pregnancy is not preeclampsia, it is not sepsis, it's homicide, right? Like, what does that mean about how dangerous it is to be pregnant in our society? And I've learned a lot in about like how Wisconsin reacts to that kind of information. And I think one of the most like kind of beautiful moments I've had in talking to people who are really opposed to abortion is really kind of those breakthrough moments where you can say to somebody, but like, what about a 14-year-old who is going to be forced to give birth to a stillborn child and die during that delivery? What about these kind of real scenarios that are happening every day across our country? Do you have mercy and compassion when it comes to that? And I think the answers have been deeply complex because the motive around abortion is not about like people's lives. Like it's not about safety. It is about control. And the same people who are anti-abortion are pro-gun on a lot of instances. The same people who are anti-abortion and want every kid kind of change their mind when it comes to immigrant children or children in Palestine. So it's been a real learning experience in terms of the way a movement positions itself and the contradictions within that movement and the kind of information that people who feel passionately need to hear in order to reconsider where they're standing.
Yeah, absolutely. So Irma, I think coming from Texas, you're like you said, you're kind of in like ground zero for a lot of this. So what lessons have you learned?
Um, apart from everything that everyone has already said, because those are very similar to what we have learned in Texas, I'll only add that we also have learned that our communities have always found a way. Um, we have built entire ecosystems of care in the face of all of these attacks, from having midwives to abortion networks to mutual aid. All of that was created by our communities, and that didn't start this past year, the year before that, or in 2020. And it's not going to end anytime soon either. So I believe like that would be the only thing I would add to what everyone has already said.
Yeah, I love that phrase, thinking about ecosystems of care. We'll talk about that a little bit later too. But Porsha, you're coming to us from a bit of a different political landscape too in Maryland, right? So what lessons have you learned there?
Yeah, it's been interesting. I think more than anything, just we have to be ready to pivot and be adaptable. I think every time we figure out what we're doing and how to do it best, they change the rules on us. And so I think more than anything, it's just been shifting. Like I said at the beginning, BAF started only in Baltimore City. And then we expanded throughout the state. And now where we are, we have this, like the geographics of who we're supporting look very different. And I think for us, it's been, our expertise as Marylanders because we are Marylanders, but like, how are we supporting people who are traveling here? How are we making sure that their care aligns with who they are, where they're coming from? And so I think for us, it's been less direct attacks on the work we're doing and more making sure that we are updating ourselves and making sure that we are able to provide care to people who are traveling in and being forced to move around and access the healthcare that they need in a way that doesn't feel like this is a stranger who doesn't understand where I'm coming from. This is not a person from my community. We're trying to extend that feeling of community for someone who's being forced out of their community and having to travel to Maryland, and just specifically Maryland and the DC area are home to 3 of the all-trimester clinics that exist in the country. So we've always kind of seen travel here. But now we're seeing folks who are traveling earlier in their pregnancy. And so we are just trying to pivot, be adaptable, and make sure that we can provide care to the person on an individual level as much as possible.
Thank you so much. Yeah, and I think your answer kind of brings us to the next question, which we were talking about kind of past political shifts and the lessons we've learned over time, but we also recognize that there are new and distinct challenges to reproductive justice that are happening right now in our current political moment. I know Irma started to speak about kind of immigrant rights and things like that. And so I'm wondering what kind of new challenges you're facing and how you're responding to those. So we can start with Irma.
I would say surveillance and criminalization and digital policing have been big topics in terms of challenges that we are seeing being weaponized against people seeking abortion, against people seeking information, period. Young people, especially since they are the main demographic that we work with, besides being already monitored by their families, their schools, it's now like their search history. And crisis pregnancy centers are now using data tracking to manipulate people. And states are just obviously trying to punish people for leaving to get that care. And so we have been trying to focus a lot of our education towards providing resources and teaching people how to protect themselves when it comes to digital policing. So providing that knowledge and also talking about what encrypted resources exist is very important for us. And we've already have had some of that work and experience in the past several years because we work with young people who just naturally are monitored a little more when trying to seek their own care. But now, like after the fall of Dobbs and in the new Trump administration, that has just obviously like skyrocketed. And it's not just young people, it's everyone of all ages. So we have been centering those challenges and trying to figure out how to get around that more than anything else.
Yeah, absolutely. And so Porsha, just kind of throwing it back to you, talking about being like adaptable, right? Are there any sort of new and distinct challenges you're facing now?
Yeah, this might seem a weird response to this, but I think what's hard for us in Maryland is there's an apathy from people who are here, our donors, the people who support us, because it's this idea like Maryland's super protected. We have the ability, people can travel, and it's not that easy to travel. Not only is it expensive, but like a lot of times someone is traveling for the first time in their life. They've never left their hometown. They've never gotten on a plane. They don't want to give their personal health information to a stranger. They are still afraid of being criminalized, even if they can get here when they return home. And so I think for us, it's been really hard to explain to people that they should care about this, even if they live in Maryland, because legal does not mean accessible, but also like while abortion is restricted anywhere, it's not accessible and it's not safe, and there's no such thing as a sanctuary. So for us, it's been hard to galvanize our community, like our core community is always going to be ready to go, but our community of donors and people within Maryland, because there's this idea that, well, since it's safe here, then people will be able to access it. And we just know that that's not true. And we have seen an increase in people who would otherwise be funded having to be sent back home because they aren't able to get their gaps filled. And so people are having to move forward with pregnancy, and that's happening here in Maryland. And so I think apathy has been the biggest challenge for us, which, you know, we are blessed to be in a state where access is, or legal access is still a thing, but it's disappointing to see how easily people got over the situation here in Maryland when it is dire, as even more than it was a few years ago. And we're seeing an increase in people not being able to access the care that they deserve and need.
Yeah, thank you so much. What about you, Allison? What kind of new challenges are you seeing?
I mean, even in the past week, I think President Trump has been inaugurated for 2 weeks now. I don't know. That was a different holiday. I was celebrating giving service back in honor of Martin Luther King Jr. instead of remembering when he got sworn in. But this week on Monday, we got notices from some of our partners from nurses for sexual and reproductive health to help spread the word that um, Trump was doing ICE raids in Chicago. And I know that this has happened in other parts of the country as well. But again, sending around information about what you do and don't have to legally about redlining people or letting certain folks in your clinics, um, you know, was a huge, just kind of taking my breath away, even bringing it up. Just the fact that we had to so rapidly kind of respond to that and get some of that information out there. And then to hear back that one of the major hospitals that do abortions in Chicago was going to let ICE officers in, it was just it was a huge trigger for me after I think I had my head in the sand kind of, because I knew President Trump was going to get reelected. And so I was prepared for that, but I don't think I was prepared for how swiftly Project 2025 was going to ramp into action like it has. And then by midweek, I got a call from my local FBI agent who has worked with me for over a decade, because I routinely get death threats at my home, to let me know that the Civil Rights Division at the Department of Justice kind of is no longer going to be funded or in operation, and that abortion clinics and highly targeted abortion movement folks, along with our allies at a lot of LGBTQIA organizations across the country, are no longer like being supported by the FBI or the DOJ, and these relationships that we were able to maintain through the first Trump presidency. So that's very troubling, and just also kind of accelerated that President Trump also pardoned several people who had faced act violations, and who had been arrested during the Biden administration, as well as letting go of thousands of people that were in prison or still waiting court trial for the January 6th insurrections. So I just think the past 2 weeks have been really fast and overwhelming, and it's yeah, I'm just really kind of on edge to say that out loud, and to know that we're only 2 weeks into this mess.
Yes, absolutely. I think you all talked about, there's risks to people seeking abortion, and there's risks to people engaging in this type of work as well. So I would love to hear a little bit also from Ali and Kelsey, and then we'll move on to our last question.
Yeah, I mean, I think I want to say that I think that it's easy to feel a certain sense of hopelessness in this moment. And I think there is, for me, as a Black woman in the United States of America, there is a certain part of me that's undaunted by this because I come from a history of slavery. And so if a lot of people have heard of a tobacco plantation, a lot of people have heard of a cotton plantation or a sugar plantation. Not as many people have heard about a breeding plantation, right? And a lot of what anti-abortion rhetoric is about turning women into breeding animals. And so I think what you see from Black women who are 3 times more likely to die giving birth, who, the maternal mortality rate in Wisconsin, particularly Milwaukee, is one of the worst in the world. The infant mortality rate for Black people is 3 times higher than it is for white folks in this community. And that's like our long-term reality. That's not new, right? And so this struggle, when you talk about what it means for Indigenous women and women of color across this country long term, we've been robbed of our autonomy and our voices and our vote over and over again. And this is a new iteration of the same program. And I think that there is a little bit of confidence boosting in that like we've seen generations of women fight for their rights effectively over time, and that we have that history and we have those tools and we have those skills, and now is the time to use them and to use them strategically in partnership with one another. But I think, for me, this isn't a moment of like shock in terms of how unjust our society can be. Our society has been cruel and unjust and robbed Black women of basic dignity and health over and over again in 1,000 iterations. And so I think the moment really requires for us to appreciate what women and folks who can become pregnant have experienced throughout history, and to learn from that and to honor those folks in that history in the fight that we're, taking on today.
I think the only thing I have to add is we are up against, I think the biggest threat, especially like people and their freedom and their autonomy being maintained, is their apathy and lack of understanding of how dangerous so many systems that should exist to keep us safe and provide a safety net have become. We are actively having to navigate the fact that there is a police substation in every public housing community in this country probably, but certainly in Alabama. Is it staffed? Not so much. Which, I'm all over the place with how conflicted I feel about the fact that you got to have the station there, but you don't prioritize the staffing, but then you do have the cops in the community to harass people. That's a whole rant. But we know that folks, like, by and large, when a cop questions them, they may not understand, like, the cop doesn't care about your freedom and actually stands opposed to your freedom. And you can't trust that this person is here to save you or protect you, because that is the public perception of this person. And then same for your healthcare providers. The primary pathway of everyone who has faced criminalization around their pregnancy in this country has been their healthcare provider. So there are some major barriers that we have to cross with just helping people who are most at threat understand who that threat is coming from.
Thanks, Kelsey. I appreciate that. So that leads us into our last question, and then what we might have, we might be able to take like 1 or 2 questions from the audience before we wrap up. But so before we end, lots of folks have talked about this idea of like ecosystems of care. And so I want to ask you all, what does collective care mean to you, and how do abortion funds put this into action? So I'll start with you, Alison.
For me, I think it's just really being in community, and knowing what our communities need or what they have or what they don't have, and not only being rooted in that, but then expanding that knowledge and network of care to people outside the community that can help you provide for the people that are, you know, there at your foundation. So I feel like abortion funding has been one of the unique ways of care and support and mutual aid that we've really seen um, in modern times for this country outside of direct bail support movement, I think. Now we have abortion funds in all 50 states, and some states like Texas have multiple, which is just amazing. Um, and because we know our community of like where we are geographically are at, but we also know our community of abortion. And because we are justice and heart centered folks, we know about the other pillars or areas of support that the people in connection with us need, and we can reach out to find those. Specifically, MAC has, and I think a lot of abortion funds now have been taking a real learning um, from the harm reduction movement with drug use. And I know MAC does a lot of harm reduction work in conjunction with our um, abortion access or reproductive freedom work. And I just think it's a great example of how we're all connected in this network to provide for one another um, in ways that, you know, our governments or borders or communities are supposed to do, but are failing us. And we, the people, have picked up those pieces to make sure one another are cared for to the best of our ability. And that is, I think, the excitement that I get inspired from hearing Ali talk, because um, nobody knows more about what we need than us, and we are going to rise to the occasion um, for reproductive freedom, but for us as whole, healthy, worthy human beings.
Thanks so much. Porsha, what about you? What does collective care mean to you?
Yeah, at BAF, we have this thing about like we take care of us. And I think a lot of times we realize that the government is not going to keep us safe or help us access the care that we need. And so, and it doesn't really matter who's in office because we've been talking about this for a long time. These have been issues for a long time. And it's, you know, people have gone in and out and they have had different political affiliations, et cetera. And so I think for us, it's like, collective care and community care is the antidote to the individualism that is plaguing us right now. And so we, like BAF started with a group of friends at a dining room table 10 years ago because they saw that their community had a need and they wanted to fill that. And it's blossomed and changed over time. But at the root of it, the idea behind the work that we do is making sure that we can take care of each other and not have to rely on external sources that are supposed to be taking care of us and that are supposed to be providing these services and the support, but they won't, and they don't want to. And so our role as an abortion fund and as community members is to make sure that if people want an abortion, they can access it, and they can access it with dignity and ease. And as long as BAF is existing, we're going to continue to take care of each other and our community, and that community extends beyond Maryland and the people who are forced to travel here to Maryland as well.
Thank you. Irma, what about you?
Very much similar to what everyone has said. Collective care is survival. It's knowing that our freedom is tied to each other. I love Adrienne Marie Brown's work, and I love one of their quotes that says that we move at the speed of trust. And that's exactly how abortion funds work. We trust that when someone reaches out for help, we believe them. We trust that communities know what they need better than any government ever could. So we trust that when we take care of each other without hesitation, without judgment, without shame, we are already building the world that we want and that we deserve. Um, the last thing I'll add is that abortion funds aren't like the same as charity. We're not just handing out money, we are practicing a model of care that refuses to let anyone be abandoned. And that in and of itself is what reproductive justice looks like in action.
Yeah, that's beautiful. How about you, Kelsey?
I don't know if I have anything to add. I think that what has been shared has been very accurate. I have one thing to add to just highlight, like, that we are what our communities need. As we've been doing this bus tour, we've been in really rural communities. The only friction, the only barrier we have encountered has been the housing authority managers. The person that sits in the office and decides who gets access to housing is now deciding if these people get access to free diapers and lunches. And it is the wildest abuse of the smallest little damn bit of power I've ever seen people given. But I think it is a testament to the fact that time and time again, government will stand in the way of progress and stand in the way of resourcing our communities the way they ask to be resourced, because people have this asinine belief that things need to follow a process, things need to have permission, people need to be aware of what you are doing at all times, and people need to sign off on it. That is bullshit. Don't let permission stand in the way of you doing something you want to do that you know your community needs.
Thanks. What about you, Ali?
Oh, that's such a beautiful thing to say. And I just want to respond to like what all of you have said. Like, Irma, I couldn't like ask for a better group of people to get to have this conversation with and to get to listen to today. When I was 23 years old, I had a 1-year-old child and I was so broke, you guys. I had a car that like, it was a Ford Explorer from the 90s and it would start by itself sometimes. And so like everything in my life was like a struggle at that point. And I didn't have a stroller. I had never had a stroller. And I saw one at a garage sale one day. And I was so excited. I was like, I bet you I can possibly maybe afford this garage sale stroller. And so I went up to the woman who was selling it and I said, "Hey, how much for the stroller?" And she walked up to it and she ripped off the price tag and she said, "No one should have to pay for something so necessary." And that was like a life-changing moment for me to be like cared for that way. No one had ever said anything like that to me. And I think about when we help somebody pay for their abortion, what we are saying to them is no one should have to pay for something so necessary. And so whether it is the way we vote or the blanket we make or the stories we read to our kids, like collective care is about loving people. It's about loving people enough to see them in the situation that they're in and be what they need you to be without judgment or qualification. I think collective care is, you know, kind of summarized in this African proverb that I really love, which is, if you want to go fast, go alone. If you want to go far, go together. We're in a position right now where we need to go far and we need to do it together.
Oh, I feel like that was the most beautiful, perfect, powerful way to close our conversation today. Thank you all so much for being in community here, for sharing your wisdom and your expertise, and your energy and presence with us. We're so grateful. We got so carried away in our conversation that I'm not sure we have time to answer any of the audience questions today. There were a couple that were directed at individual panelists. And so I highly recommend, you know, folks staying in touch and reaching out, but I would love to hand it back to Ali to help close us out with a poem.
I just want to thank the other panelists for everything you had to say today before I read this, and I hope that folks find this encouraging. It's called World's End. This world has gone dark more times than you or your mother or her mother can remember. And every hurricane was meant to be the end of it all and has instead ended in sunshine again. So believe me when I say, you will survive this and the next one too.
Oh, thank you so much. It's beautiful. Again, I just want to say, I'm just filled with so much gratitude. Y'all are so incredibly amazing. Thank you for the work that you do in your communities. Thank you for being here with us. Again, just sharing your wisdom. We're so incredibly grateful. Thank you to everyone in attendance for being a part of this amazing event and for your commitment and your efforts to confront issues of injustice that we're faced with. Just some kind of last minute housekeeping notes. Just make sure you watch out for an email with a link to complete the conference evaluation, and you'll get an email with your CEUs if you've requested those. And just remember that a link to the recording of this session will also be posted on our conference website. So feel free, everyone, to take a little break and join us again at 2 p.m. Central Time for our keynote address, which will be led by Miriam Kaba and Kelly Hayes. It should be a fantastic conversation about organizing and collective care to continue the conversation we had today. So thank you all again so much. You're amazing.